Hi, I'm Dr. Jill Fortain, licensed psychologist and director of test development here at MindMetrix. In this short video, I'll introduce you to MindMetrix. We'll focus on what MindMetrix is, how the assessment works, and how to use the report to better understand your patient and clarify your diagnostic impressions. MindMetrix is an adaptive, comprehensive mental health screening and assessment tool. It creates a structured, cohesive clinical picture upfront and is designed to support diagnostic clarity and confident, data-driven clinical decision-making from the outset of care. Patients feel seen and understood, which helps build rapport and lays the foundation for a collaborative, trusting relationship with their provider. Organizations obtain more consistent, structured data to support internal quality and outcome initiatives. MindMetrix screens and assesses for more than 60 DSM-5 conditions and related clinical concerns, including mood, anxiety, developmental, trauma-related, sleep, eating, and substance use disorders, in addition to psychotic symptoms and suicide risk. This comprehensive approach helps clinicians look beyond the presenting problem, identify potential comorbidities early, and make more confident, data-driven decisions. MindMetrix is organized into 4 phases. The basic flow is simple. It starts broad with key symptom detection, then assesses the impact of the symptoms the patient endorsed. From there, MindMetrix goes deeper where clinically indicated, pulling in an individualized test set made up of validated rating scales for each endorsed condition. The final section gathers life factors and context, including well-being, personality traits, and adverse childhood experiences to help clinicians interpret the results within the broader clinical picture. In a study of over 2,300 patients at a large outpatient behavioral health facility, patients who completed MindMetrix at the start of treatment showed PHQ-9 scores declining about twice as fast and were more likely to remain engaged in treatment at 60 days compared to their control counterparts. Clinically, this makes sense. When clinicians have a clearer picture earlier, treatment planning can become more effective sooner, and patients start feeling better sooner and feel more connected to care. From the patient perspective, MindMetrix was designed to be easy to complete on a phone, tablet, or computer, either from home or in office using kiosk mode in under an hour. The initial symptom screen items were written at a 7th grade reading level to support accessibility, and patients can pause the assessment and take breaks as needed. MindMetrix was designed to complement your clinical judgment and decision-making, not replace it. It's best suited for patients who can meaningfully engage and self-report. It is not a substitute for full psychological or neuropsychological evaluation when that level of assessment is needed, say for neurocognitive concerns, learning or intellectual disabilities, or autism spectrum disorder. That said, MindMetrix can help clinicians decide when a referral for a full neuropsych evaluation may be warranted, and we state that in the report where appropriate. As soon as your patient completes their MindMetrix assessment, you get notified and can download their results report. It includes an orientation to the patient, a page we call clinical orientation, a summary of possible explanations for their symptoms and likelihoods, and contextual information such as personality traits, overall wellness score, and validity indicators. The patient does not automatically receive a copy of the report. We highly encourage clinicians to share this report with them after reviewing it together. We've been thoughtful about the wording, and the report clearly communicates that it is ultimately the clinician who has the final say on diagnosis. When reviewing the report, the clinical orientation page is your starting point. It's there to orient you to the patient, support case conceptualization without getting diagnostic, and make that results visit more focused. Some practitioners choose to read this page verbatim with their patients, who often find it very validating. It shows the key symptom patterns they're experiencing, any life context that may be affecting them, and it alerts you to parts of the report or specific data points that may warrant conversation. Here are the two key summary pages in the report. They're designed to support both clinical decision-making and patient understanding. The possible explanations framing is intentional, as these are not definitive diagnoses. The page on the left shows the results of the initial symptom screen, with bolded conditions warranting further testing. The page on the right shows the results of that follow-up testing, with conditions organized by diagnostic category. Here you see the scale results and elevated likelihood estimates for each condition. The elevated likelihood figure indicates how likely it is that the tester's symptoms are explained by that condition compared to the average adult in the US population. It's calculated using the patient's obtained scores, each rating scale's established cut scores, the sensitivity and specificity of those scales, and the condition's prevalence. For more information about the calculation, please check our website. Suicide risk is also flagged here when relevant. You will also receive an email alert when moderate or high risk is detected on the Columbia Suicide Risk Severity Screener, so you can assess for imminent risk and take the next steps to ensure your patient's safety. Each detected condition has a details page included in the report, which gives clinicians measurement-based information and clinically relevant next steps. The page on the left begins by showing the condition name, any relevant specifiers that were detected, and a brief overview of what the condition is. Next, the assessment results are summarized in the teal box, including an accurate interpretation of that elevated likelihood figure, followed by the patient's results on each of the rating scales and additional information about the tool to support interpretation of those results. The page on the right shows the clinical considerations, which are individually tailored to each patient's unique results. These differential diagnosis steps help translate the results into focused clinical follow-up and support conversations with patients about what else may explain their symptoms. The raw responses can be especially helpful for clinical conversations and making sense of any unexpected conditions endorsed in the report. The raw data report shows every item administered and how the patient answered it. It allows the clinician to ask more specific, diagnostic, and patient-centered follow-up questions. Like, I noticed you endorsed this specific concern. Can you tell me more about how that shows up for you? This type of inquiry often leads to a more accurate diagnosis and a more meaningful collaborative discussion with our patients. So to wrap up, MindMetrix helps clinicians begin care with a clearer, more comprehensive clinical picture. That foundation supports diagnostic clarity, collaborative treatment planning, and more confident, data-driven care from the outset, ultimately helping support better patient outcomes.